Hello, everyone. My name is Dr. Yu-Cheng Chang. I'm currently serving as Assistant Dean of Emerging Technology in Patient Care and Clinical Director of a Periodontal Clinic at Penn Dental Medicine. So digital dentistry actually means we capture the plans and fabricate everything as precise data instead of a plaster, wax, or film. In general, you might have experienced a lot of dentists. You put a lot of very crazy term or the term you're not familiar with it, and it's very hard to understand. With the emerging technology digital, we're able to make this procedure like visualize, so you get better picture understanding about what dentists plan to do, what's the treatment plans, and what outcome expectation. One example, an intraoral scan probably take very comfortable. Usually, dentists will have put this alginate impression, which the material takes like jelly in your mouth, and leave it there about 60 seconds, and could make a messy and gagging reflex. And this digital intraoral scan actually can take very comfortably without you have gagging reflection. And after using the information, we were able using that other software to let it design the crown, aligner, surgical guide on the screen, or we can use mill or 3D printing procedure to fabricate your restoration. So my clinical judgment still guide every step, but this kind of digital tool simply give us great accuracy, speed, and comfortable of the patient. And the best part of this, all the scanning, all the information we acquired through digital technology, we're able to present you maybe on at the chair side. So you will be able to understand each step what dentist plan to do. At Penn Dental Medicine, we have more than dozen optical scanner and replace the gooey impression material that I mentioned earlier. We also using extended care to giving the low dose cone beam CT, which means a three-dimensional X-ray for 3D image for bone, nerve, and all another structure used for every specialty, such as oral surgeon, periodontist, oral medicine, and restorative dentist. And the best part, we can also put in-house design and milling. We had center to produce those kind of restorations, such as crown, abutment. That means the patient when they work in panel medicine, if the cake selection is right, and the schedule work for everyone, that you may able to walk in without the tooth and walk out with the teeth and the crown in the same day. This apply to the crown, night guards, and of course, some people just like we're not looking for the speed, but looking for the quality. And this image you can using for implant guide to help us to secure the precision of the neurosurgery. And adds on our virtual treatment plan lab, which means the faculty, student, resident, we can all review the case together, take advantage of this digital technology. And the best part, everybody hear about this artificial intelligence tool. Now they can be highlight earlier caries or bone loss. The result for the patient, most likely shorter visit, fewer remake, and the visual that patient can actually understand what dentist trying to talk about it. I'll make one example because since I am the periodontist, we play dental implant every day. So the patient will walk in our clinic. They're missing the tooth there, and the chip complaint. I want the tooth back because I have a bad car accident. So that visit, the dentist will first greet you to get all the medical information, like your past dental history, to make sure your health is good and in a good condition to proceed the treatment there. The first single visit, then we will probably acquire all the information, such as scanning system we talk about, and also fabricate your comprehensive treatment plans. We get the three-dimensional X-ray and to analyze the area. About the minutes after we taking all the information together, we can all discuss on that. And then step two, the CAD CAM, there's some software that we can propose how the crown it can be look like. The research doctor or general dentist or periodontist, they can or the lab technician that can actually adjust the feet virtually. Then the step three, if needed, the chair side adjustment verification will be necessary. Then after that we finish all this information, we can merge all the file together, verify, double check one more time because we have all the clinical data and digital rendering at the moment now. Then we can send the file in-house to mill or to print. It roughly take about 15 minutes to 30 minutes. once we finish that, the lab technician, they can put some polishing, standing, make it tooth look better, looks nicer, looks like more real teeth there. They can standing, glazing, and cement, and then the patient can leave with a finished final restoration for that. Of course, usually we require a patient to come back a week or a month to follow up about see the fitness and also the feedback about the new restoration. So this entire three-dimensional file actually can be stored in the cloud-based and also secure area secured by university. So in the future, if something happen, like something bad accident or some thing need to be redone, you probably don't need to go back to the dental chair side again to get all the information from start over again. And maybe the traditional way, the doctor will have to put a stone model. It's very hard to find. But now this data will be very easy to access. We can just go back to our secure cloud system and download the file and reproduce and remake the new restoration for you. And will be more accurate and also faster. And in my opinion, it's also kinder to the tissue. So the most popular feedback and the feedback I was received from the patient almost always mentioned the comfort first. Putting that in-person material in the mouth, be honest, is not the most comfortable experience you ever have. And after remove it, a lot of time you make your face very masked, your clothes may get dirty for that. So digital technology can replace all this disadvantage through the traditional approach. So patients love that. The children barely notice the scan. Even instead, they will think the scan is so cool. There's some machine put some light. It usually come with some cool music and easy for the children to allow the dentist to operate in the mouth there. They also appreciate the convenience. The crown and guide in one appointment instead of 2 or 3 that just make the treatment efficient but also precision. Showing the color code 3D model and the bone loss and crowding, building the trust that boosts the treatment acceptance, which means if a dentist is able to present you the tooth movement, how the crown look like, the color, and how to improve your current dentition visually, then I'm pretty sure most of the patient will be more acceptance because to see and to believe. And of course, because the digital scan are so precise, I believe the lab actually will actually experience much less remake, and patients spend less time coming back for further adjustment. Of course, one more thing, patients also appreciate when something happens. For example, people have nightguard and the dog ate it, drop on the floor and crack. And we may not, if it happened in a certain period of time, the tooth is still secure. We don't need the patient come back. We can refabricate that the nightguard and deliver to the patient. Of course, chair side adjustments still be necessary. Opportunity are enormous. The artificial intelligence, that auto chart parallel pocket, remember that's definitely in the future will lead to. You remember if a periodontist, when it comes to see a periodontist, we always take a probe to give you the probe all over the mouth, give it number 1, 2, 3, 4, 5, 7, something like that there. In the future, the technology, if once overcome the accuracy and the precision and the reliability, then they can replace those kind of traditional method and totally improve the patient's comfort for that. And 3D printing bioceramic that can actually accelerate the bone healing, soft tissue, and portable scanner actually let us be more. The patient be operated more remotely. We can travel the machine, once the machine gets smaller, we can deliver the good high quality of care in the rural area. The challenges are still just as real. You know what? With this digital technology, all of the data actually was being uploaded. So it's a challenging for all the institution or organization industry to make sure this data are keeping in the safe, secure area that are unbreachable to avoid something, the cyber attack, those kind of unforeseen event there. And then other things such as scanner, printer, electronic record, I'm pretty sure they all have to be updated. In the future, we can speak the same digital language. They'll make this workflow much more smoother instead of the software A have difficult how to software B. But I'm pretty sure that we can foresee that this language improvement can come. And our digital innovation initiate techless this heads on. So adopting is evidence-based, secure, and financially sustainable for private practice. One thing also the big challenge is because the popularity of digital technology, they move fast, they improve so fast. The challenge for myself, the biggest challenge will be we need to make sure our faculty, our dentists, or the specialty and the student, they keep the same speed to keep adapting new information because thing whatever happened a year ago, thing will be different in the 2 years. We heard about this artificial intelligence term getting popular about a year and a half. Look at today, how there's so many different generation of the algorithm has been created for that. So ultimately, digital dentistry isn't about the gadgets. It's about giving every patient faster, safer, and more predictable care.